If you're over 70 and your morning blood sugar keeps creeping up no matter what you do, even with metformin, even eating well, please hear this. You are not doing anything wrong. This isn't about last night's dinner. Your body is doing something before you even open your eyes. Carol was 72 years old the morning she checked her blood sugar 2 hours after breakfast and watched it climb from 148 to 187, higher than when she woke up. She put the glucometer down on the kitchen table and sat there trying to understand what she'd done wrong. She had eaten what the list said. She had taken the medication. The number still went up. Her doctor's answer was what it had been for 8 months. Give it more time. Here is what was actually happening. Carol's liver doesn't stop releasing glucose when her alarm goes off. It keeps going, building toward a peak somewhere between 7 and 8 in the morning. The metformin was doing its job. But there is a second window, the morning one, that the medication doesn't touch. When Carol ate breakfast at 7, the food landed on top of that peak. That is why the number kept climbing. Not what she ate, when she ate it. The people who never hear this keep eating at the same time they always have, and watching that number climb with no explanation. The ones who hear it make one change to how they start the morning, and that number stops climbing. Here is what is actually happening inside your body every morning. Think of your liver like a slow-release tank. All night, it has been quietly sending glucose, that is, sugar, into your blood to keep you alive while you sleep. Most people have heard of this. What most people have not heard is what happens after they wake up. The tank does not shut off when the alarm goes off. It keeps going. Your body releases a wave of hormones in the early morning, cortisol, growth hormone, and others, that tell the liver to keep pushing glucose out. The liver peaks somewhere between 7 and 8 in the morning. Researchers call this the dawn phenomenon, the extended morning rise in blood sugar that happens before your first bite of food. If you sit down to breakfast at 7, your food is landing on top of that peak. The glucose from the food stacks on top of the glucose already in your blood from the liver. That is why the 2-hour number after breakfast can be higher than your fasting number was when you woke up. And here is the part that matters most. Metformin, and every other oral medication used for blood sugar, does not stop this morning peak. It was not designed to. The medication handles what the liver does overnight. The morning window is a separate problem. No pill currently available closes it completely. Your liver does not stop producing glucose when you wake up. It keeps building to a peak between 7 and 8 in the morning, and that is exactly when most seniors sit down for breakfast. Researchers confirmed this pattern in people over 70 and found that the size of the morning rise was the same across all age groups. Getting older does not soften it. That data came from a diabetes care study tracking the dawn phenomenon across different age groups, including people in their 70s. What that means for you, the morning peak you are experiencing is real. It is well documented, and it does not shrink just because you have been living with it longer. Seniors with confirmed dawn phenomenon who walked before breakfast, not after, cut their dawn glucose rise by nearly half. That finding came from a study of 34 people with confirmed dawn phenomenon, published in Biomedical Research International in 2020. The walk was moderate, not intense. Done before eating, not after. What that means for you. A short walk before breakfast. Not a hard workout, not a long one. Targets the morning window directly. Walking after breakfast works differently. It is not the same lever. Moving breakfast from 7 in the morning to 9:30 cut the 2-hour post-breakfast glucose spike by more than half. That came from a clinical trial published in 2024 in Diabetes Metabolism and Syndrome. Participants simply delayed when they ate. The food was the same. The time was different. Eating past the peak of the morning liver surge rather than on top of it is one of the most direct changes you can make without changing a single ingredient. The dawn phenomenon adds approximately 12 milligrams per deciliter to the 24-hour glucose average and nearly 0.4% to HbA1c, and it is not eliminated by metformin or by any other oral medication, confirmed across 248 non-insulin patients in diabetes care in 2013. That 0.4% matters. Over time, it is the difference between a stable HbA1c and one that slowly drifts. What that means for you, If your HbA1c is not moving the way you and your doctor expected, the morning window may be the reason, and the medication is not going to close it on its own. There is one specific population that needs to hear a warning before the protocol. Seniors over 65 on insulin or a sulfonylurea, glipizide, glimepiride, glucotrol. Only 1 in 13 correctly identified when their blood sugar was actually low in a 2009 diabetes care study, which is why delaying breakfast is not a DIY decision for this group. The hormone response that causes low blood sugar was intact in these seniors. The problem was that they could not feel it happening. What that means for you: if you are on insulin or one of those medications, the protocol below has one lever that is not yours to pull alone. I will name it directly. What Carol didn't know, and what most seniors on oral medication are never told, is that the number on her glucometer 2 hours after breakfast was not a verdict on what she ate. It was a verdict on when. So here is the protocol. 3 levers. All 3 matter. If you have been walking after your meals to bring the number down, that walk is doing something real. But if you moved it to before breakfast, it would work on the window that is actually driving the morning spike. A short walk, 15 to 20 minutes. Before you eat in the morning is the first lever. You do not need to push hard. Moderate pace, done before the first bite. Eating at the peak of the dawn curve doesn't just raise the 2-hour number. It starts the rest of the day from a higher baseline, meaning every meal that follows is hitting a body that is already running behind. Moving breakfast back by 60 to 90 minutes is the second lever. You are not skipping it. You are letting the liver peak pass before the food arrives. Ask your doctor this specific question: is it safe for me to delay breakfast by 60 to 90 minutes given my current medications? Write it down before your next appointment. Carol had been on Metformin for 3 years. The medication was doing what it was supposed to do. The morning window was simply something no one had told her was also there. Once she understood that, the third lever made sense. Make the first meal lower in fast carbohydrates: bread, cereal, juice, sweetened yogurt, and higher in protein and fat: eggs, unsweetened Greek yogurt, nuts. Not a perfect meal. A first meal that does not amplify what the liver has already done. If you are on insulin or a sulfonylurea, do not delay breakfast without first speaking to the doctor who prescribed it. This is the one lever in this protocol that is not a standalone decision. The other 2, the pre-breakfast walk and the first meal composition, are lower risk, but your prescribing doctor should know you are making any change to your morning routine. Before I close, let me tell you what happened to Carol. 3 weeks after Carol moved breakfast back by 90 minutes and started her walk before she ate, she was clearing the breakfast dishes before 9 instead of sitting in the chair waiting for the fog to lift. Her 2-hour number had stopped climbing. Her fasting number was still a conversation she was having with her doctor. That part had not resolved. But the morning had changed. She told me she had spent 8 months thinking she was doing something wrong. She wasn't. No one had told her the morning window existed. Once she knew it was there, she could do something about it. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. You are someone who now knows that the number on your glucometer 2 hours after breakfast is not a verdict on what you ate. It is a message about when you ate it and what your liver was already doing when you picked up the fork. If you have a spouse or family member who is managing blood sugar after 70 and still cannot understand why their morning number keeps climbing even on medication, share this with them before their next breakfast. I get messages every week from people who are doing everything right: the medication, the diet, the follow-up appointments, and still watching that morning number climb. If that is you, I want you to know this channel exists for exactly that reason. Every week I bring you something specific, something documented, and something that the standard 15-minute appointment does not always have room for. If that is useful to you, subscribe so you do not miss it.